you. Yeah, hello everybody. So excited to be here. Travel physical therapy has become a very hot topic. I attend a lot of career fairs. I get to interact with a lot of students and even other professionals at the state and national conferences. And it's one of the most talked about things that's out there right now, especially amongst our new grad population. And doing a lot of interviews, so really wanted to present a little bit on travel PT in general and a program we call the Voyager Travel Program, which is specific to Confluent Health. Many of you have probably seen, heard, talked to your colleagues about Travel PT. Travel PT allows you to, again, experience unique states, different opportunities, work in different settings, and do it under a different pay structure, while still, utilizing your skills as a PT. Now, with that, there are some challenges that go along with it. So we're going to talk about that a little bit. But first, I want to bring up a slide here, share my screen. So here we go. The Voyager Travel Program is the Confluent Health version of a national travel program. Our organization has a nice footprint throughout the United States. And when I'm interviewing an individual, I usually ask them a few basic questions about travel, why they want to travel. First is the obvious: experience new locations, be involved in different settings. It's like an internship where you're getting paid, right? You're able to go and experience new things. Two is student loan debt has gotten so high. A lot of people tell me that there are better income opportunities in the travel industry, and that's one of the selling points that travel agencies will have when they're talking to students. Now, there's some nuances to that I really want to talk through, and we'll hit that further in the slide in the presentation here. If you look at opportunities throughout the country, not all opportunities are created equal. We primarily function in the outpatient environment, but there's skilled nursing opportunities, there's assisted living opportunities, there's pediatric opportunities. So there's a plethora of opportunities that are out there. Some of the basic concepts of travel PT is they're usually broken into 13-week assignments. Now, there's no magic to the 13-week assignment. If you basically take a 52-week year and you divide it into 4, it comes out to 13. So it allows for 4 assignments a year, but it's not a hard, fast rule. There's no State Practice Act. There's no contract obligation. Those timeframes can be shorter or can be longer. Now, if you think about onboarding, orientation, getting used to a facility, 13 is generally a sweet spot where you have enough time to learn the systems and processes, get used to the area, explore the area from a travel perspective. So I usually do like to encourage somewhere in that 3 to 4 month time frame to allow people to settle in. This is a sample travel assignment that we put together. And here what I did is I mapped out really a 6-month travel assignment. And you can see that we break them into 13-week segments, just like a travel company would for you that's an external travel company. Jack Travel PT here is going to Twin Falls, Idaho. And then he's going to go over into either Oregon, Wyoming, Montana, or Washington. And then we're going to bring them down to Florida. So these dates are always mapped out so folks know where they're going. There's time built in between assignments so that the travel can commence. And that's one of the things that's nice about having a roadmap mapped out is you could plan housing where you're going, because housing is not provided with travel assignments. Assistance with websites, Airbnb can be provided, but typically housing is not provided with these travel assignments. Details matter as far as how this works. One of the reasons that the pay rate tends to be higher for these is that some of the pay is not taxed. And the reason I say details matter is the IRS is not an entity that you want to fly by the seat of your pants, right? And when we set our program up, as should any travel agency you're working with, everything should be based off of IRS rules and regulations. There are rules and regulations for how per diems are paid, what is taxable, what the per diem rates are per geography. And I like to use this example. If you want to travel to Northern California wine country, it's going to be a little bit more expensive to live there than it is to live perhaps in the mountainous area of Western North Carolina. So the per diems will be different, and there are IRS guidelines for that. One of the things that we really like to have people focus on is what are the resources that are helping you navigate this travel environment and this new pay structure. If you're coming from a position where you are paid and taxes were taken out and there were no per diems, you in the travel world, you have to navigate that yourself unless you have resources. So in the Confluent world, we have a dedicated HR payroll person that handles that piece of it. And the onboarding and training process is a significant piece as well too. In our world, you onboard once, you train, you understand the EMR, the compliance requirements, the billing guidelines. That is portable, it goes with you. Same thing with the benefits piece. Full-time jobs come with benefits. That's true in the travel world. However, if you take different assignments that don't have continuous benefits, you will lose your benefits and potentially have to go with COBRA, which is where you pay in between, or go get your own insurance, or some folks potentially would be without insurance for a period of time. So that's a consideration that we always tell any travel physical therapist to make sure they understand the nuances. And then in our organization, you learn use of an EMR during your internships, or if you're already working, you've learned the use of an electronic medical record documentation system. In our organization, about 90% of our locations use the same documentation system. That's not true everywhere, eventually will be, but again, that's a consideration for where you're going. If it's a paper system versus a system you don't know, there's a learning curve to that. Moving on to the tax questionnaire. This is something, again, I go back to the IRS guidelines. You have to establish what's called a tax home. Your tax home is the permanent residence that you have established, because remember, this is a travel program. So when you travel, you have to be traveling from somewhere. So I don't get into how you choose your tax home. I really try and help educate folks on what the guidelines are for it. It could be your apartment that you're leasing. It could be a residence at which you have stayed previously. There's a number of options for that, but the tax questionnaire is an important component of traveling so that you qualify for the tax-free pieces that go with this. I wanted to show a sample pay matrix. One of the things that's always asked about and shows up in Indeed ads and elsewhere and when you're talking to agencies is the pay matrix. How does it work? There's an hourly rate, which is set by state guidelines. There's a minimum wage for each state, and that is the taxable portion. And for instance, if your hourly rate were $21.10 on a 40-hour basis, $844 would be taxable. There's a per diem rate. Per diem is a term that refers to the stipend that you're getting for housing and living expenses. That's set. These are called sample pay matrices because one I think we used is off of Georgia. Another one might be off of, I think it was off of Florida. There's a per diem rate. These housing rates, if you want to stay at Martha's Vineyard during the spring, it may be higher because the cost of living is higher there. That per diem rate is non-taxable provided you meet the guidelines of the IRS. There's also a meal rate or a per diem for meals. Again, same thing set geographically, and that is also non-taxable. So the way this usually shakes out is there is a weekly total, and if you're talking to an agency or if you're talking to us, we establish what your weekly pay would be, and we help you break it out into what's taxable that you'd get a W-2 for and what's not taxable that you would need to have records of. So a couple examples here regarding how that pay matrix looks. And I want to highlight that this is a sample pay matrix. It totally depends on the area, the geography, the time of year, and it's all based off of federal per diem guidelines. You should, as a full-time employee, be receiving benefits with this position. You can choose to decline benefits. Benefits are a big piece of what we offer here at Confluent Health. most travel companies offer you benefits. The question is, are those benefits continuous? Are they good benefits? Are they necessary benefits? And at Confluent, you are an employee. Your benefits are the same as any other employee in our company, and they are portable. They go with you. Another piece that I talk to new grads about extensively is mentoring and professional development. And we're going to have a few questions about that when we get to Spencer here in a moment here. But on the mentoring, as a new grad, you've got all of this great knowledge you've obtained. You've put those skills to practice out in the internship environment. Now you're out in the work world. When you travel, mentoring is something that's still a necessity. Travel therapists need it just as much as a fixed location employee. What we have in place is something called a professional development plan. It's a specific 6-month program that focuses on skills development. And when somebody says they have a mentoring plan, the question that I like to have them ask is, well, tell me about that. Is it structured, right? How often do we meet? What's the mentorship look like? Am I assigned a mentor match? Those are all pieces in our organization that we are committed to. And those are things that any traveling therapist should be asking their travel company. If I'm going to a place that I've never been before, that I might have had a short interview with, those are questions to ask. As a new grad, you want to make sure your skills continue to grow and develop. So the PDP is a core function of ours. We also have something we call Core 4 courses that lead to specialty training and potentially board certification to develop expertise. This is another portable benefit in our organization. And with a travel company, any travel company, Confluent or not, there should be continuing ed benefit, because in order to keep your license, you have to have continuing education credits. So from the perspective of how are you going to continue to develop your skills, how are you going to satisfy the requirements of your license? And remember, any state you travel to, you have to have a license for that state. So when you have courses that are approved across the spectrum, say through the American Physical Therapy Association, they will count towards licensure in that state. There may be different processes for making sure they're recognized, but the APTA does a great job of that. One of the things that our company does is we make sure that our courses are approved. We use a company called Evidence in Motion for our continuing education courses. We don't use them exclusively, but we do use them significantly, especially in regards to our Core 4 courses. So that's an overview of what the Travel PT program in general looks like. Everything that I've reviewed here is specific to Travel PT, and there are components that are more relevant to Confluent Health that we have taken and really expanded to include the employee experience. But what I did want to do is make sure there was a good overview, educate, so that the right questions can be asked, whether you're looking at traveling with a company that is national or a company like Confluent Health that has locations everywhere. I'm going to pause there for a moment. Allison, I didn't know if there was anything else you wanted me to cover before I transitioned over to Spencer, or Emily, did you want me to go through some of the questions that were sent in now?
Yeah, I think we can bring Spencer in. I think a lot of those questions, either of the two of you can tag team those. So let me bring Spencer and you guys can go through those questions together.
Perfect.
Hi, everyone. I'm Spencer Turnbull. I'm a travel physical therapist through Confluent Health. I've been with Confluent since January. I started out as a new grad traveler working for an agency and did that for almost a year, and then got the opportunity to work for Confluent in the Voyager program, and I'm very thankful for that opportunity. Randy, do you want me to just go off of the list of these questions that were emailed to me, or are there any live questions that need to be answered?
Yes, Spencer, I think take the questions that were emailed in, and then we'll get to the live questions or additional questions posted in the chat.
Sure. So the first one I have, asking about the benefits of doing travel PT versus a permanent outpatient position. for me, I mean, it's in the name traveling. If you want to, see different places, experience different areas of the country, then for me, that's the biggest benefit. It does give you a lot of opportunities to meet a lot of different people, a lot of different patient populations as well. You'll notice as you move around, you'll see a lot of the same things, but the populations themselves will be different, and that's pretty cool. Challenges faced as a travel PT. For me, in my experience, learning, and this is going from, working in an agency, learning new documenting systems was one of the most challenging parts for me. You're there for 3 months, then you move, different documenting system. I think working for Confluent and having one documenting system is one of the biggest perks about this program, honestly, from a stress standpoint, because that was definitely one of the biggest challenges for me. And then housing, Randy touched on it earlier. I've had good luck using an app called Furnished Finder. It's kind of like an Airbnb style for contract employees. And I've had good luck with that app. But yeah, those are the biggest ones.
Yeah, I think Spencer too. Staying on the documentation piece, some of the feedback that I've gotten is, every place has an orientation process, right? Everybody has a compliance training process, right? And when you go from location to location in the Confluent world, it's all covered, right? You're onboarded once, you go through our compliance training annually. When you travel different assignments with different companies, it's a new onboarding, it's potentially a new EMR, it's another compliance version that everybody has to have. So I think from the perspective of looking and saying, okay, is it easier to stay with one company? That's potentially the case.
100% agree. It's one of the biggest perks. Next question. How to make the most out of a 13-week duration. If you take the 13-week rotation at a certain location, get out and, explore. That's my biggest advice. Usually the people that are there have good recommendations on places to go, things to do. Just don't be scared to get out and, do stuff by yourself. If you're not around any friends, just get out there. The next question, is it better to go rural or get the pay cut and go to better locations? That's kind of personal preference. If you would rather, I'm not, Randy, you might have to help me out on this one. I'm not sure what the difference is pay based between rural and a more metropolitan area through Confluent. I'm not sure.
Sure.
Yeah, but if it's, yeah.
Yeah, so it's a great question. And so here's the way I typically answer this is we use federal per diem guidelines when we set the base rate, right? Now, we all know this. There's destinations that are more popular than others, right? And there's also destinations that are probably less popular for whatever reason, right? And what often happens is people will add kind of what I call a premium, right? They'll pay on top of that as an incentive to go there. So going back to where we started the conversation, if part of the allure of the travel is the economic side of it, right? Like I know as a travel PT, I may be able to make a little more money than I might as a fixed location. Then absolutely taking those rural or those hard to fill where there may be an extra preferred rate for that. But that's individual. That's not the federal per diem. That is something that they may add on top of it as an enticement. So yeah, if there's high loan debt, and you're great with exploring maybe a really rural area for a period of time, it can absolutely make sense. But I go back to what you said, Spencer. I think it's personal preference.
Yeah, definitely. For me, I love the city, so I kind of I stay away from the rural areas. But yeah, if you want to do it, more power to you. The next question, how to deal with bad clinic operations or how to deal with different environments across assignments. Luckily, through Confluent, I have not ran into this. But you're on a contract basis. You're not there forever. So if you don't enjoy how it operates, or maybe even a coworker, if you're in a situation like that, it's not permanent, and they always want feedback between contracts, so you can give them your feedback for future reference whenever they're maybe placing another travel PT there. So that's also a good conversation to have. And then building on that, the next question is how to build good professional relationships with new clinic staff. Just be you. It's nerve-wracking going into a new place for the first time, especially if you're starting out as a new grad. You're nervous. You're like, am I allowed to do this by myself yet? and it is nerve-wracking, but back to the mentorship and the professional development that Confluent offers, they really do make you feel comfortable, and they will not overload you. And those boundaries will be set during the first day. They'll give you a new grad caseload, which could vary. I've only worked at Physical Therapy Central as part of the Confluent brand. Those could vary state to state. I'm not sure. I don't know if it's universal. But no, they will not bring you in as a new grad and expect you to perform like you've been working for a year. They will never ask you to do something outside of your limits, outside of your boundaries.
Yeah, and that, again, going back to the old adage of pick and choose your partners carefully, right? From the perspective of knowing who you're working for, I always encourage anybody interviewing for anything or considering anything, ask the questions, understand the expectations, and if there's red flags on those expectations, then I think it leads to additional conversation. One of the things with the Confluent Travel Program is our goal is you are an employee and we want to see you as a long-term employee. Now, it's not a lifelong commitment, but I think as an employee, we expect the experience to be different. You're not temp labor just coming in for a period of time. You're part of the Confluent family, and you might be going to visit a different relative in the family, for your next 13-week assignment, but it's still the Confluent family. It should have similar expectations. As Spencer stated, they may not be exactly the same, but they should be very similar amongst the different brands in the Confluent company that you would travel to. That's the challenge in kind of what I call the external travel world is you need to vet it and make sure that it's the right fit for you and that the expectations based on your level of skill, where you're at in your career, are appropriate.
Yeah, I agree with you 100%. I don't think there are any new questions. I think everything else pretty much we've covered. Is there anything I left out? I had a list and I'm pretty sure I got through.
Spencer, one of the things that I wanted you to touch on, if it's okay, is, I talked about the professional development plan and mentoring, and you mentioned as well too, is that, when we have new grads or even newer therapists, or could be a therapist who's more seasoned who changed from, skilled nursing coming over to outpatient, right? There should be mentoring and development opportunities. I just touch base on, your PDP, right? Kind of where you see yourself at, and, do you have a plan?
Yeah, that's good. That's good. Thank you for bringing that up. The PDP where I am currently, we have one course every Tuesday. I think it's the second Tuesday of the month, every month, and it covers different. We started from cervical and worked our way down. I think we're at the knee next. I've been to 4 of them now. This will be my 5th one. Those classes those are great. That's something that travel agencies do not offer. Whenever I went to my first one I got the idea of what they were going to be like. I was like, oh, this is perfect. Going over things, different manual techniques, different things during the eval that you could have been not going over as thorough as you'd like to be. Just refreshers. They're really good refresher courses to make sure that you're the best clinician you can be. The core 4, I didn't make the first one. I'm scheduled to go to, I believe, Tulsa, which is an hour and a half north of Oklahoma City, where I'm located right now, for a lumbopelvic course. And I know you've mentioned that those courses are available in all different markets. So if I start here and I do one core 4, I can move to, say, I don't know, Colorado, and do a different one, but still keep the same schedule. And we can schedule the assignments based on that as well.
Yeah, that's correct. And that's what I was referring to earlier about the core 4 and the portability of what I call these expanded benefits. Just because you go to a new location doesn't mean you don't need to continue to grow and develop. So part of our team stages these courses around the country regionally. And part of what we do with our travel team is make sure that where they go, right, they have access to these core 4 courses, which as any employee would, because as a Confluent Health Voyager, you are an employee, so you're eligible for the courses wherever you go. And we really work hard to make sure they align with that. So no, but that's, it's a perfect segue, Spencer, into the benefits piece of it. Because again, one of the 2 other things I want to highlight is the health insurance piece, right? That does and will travel with you on your next assignments, right? It goes with you. There's no discontinuation of health insurance. There's no, you have to go get it on your own. And the other piece that goes with that also is your PTO, where you continue to build, and that travels with you as well too. So there can be time off in between assignments. And the great thing about having PTO is that's paid time off, right? That's the acronym is. So Spencer, I don't know that have you had any PTO yet? Have you had a chance to accrue that with our organization? Nice.
I have. It's great. That's another thing that the agency I worked for previously did not offer. It was not as flexible as what you guys do. So yeah, it's been great.
Yeah. And again, I just go back to the core piece that as an employee, there's certain perks and benefits that you are able to be part of versus a contractor external that makes it difficult to partake in those things. It's actually impossible because you're not an employee. So no, that's great, Spencer. We'll really appreciate, answering those questions. Emily, did we have any other questions that came in through the chat? I didn't see her, Allison.
I'm not seeing anything. I think you guys covered everything perfectly.
Yeah. And the last thing I just wanted to touch on here as we wrap up this segment is I had a question of what's the process for determining assignments, right? It's collaborative, right? We look and see where we have states and openings and opportunities, and we ask the employee, where do you want to go, right? What's on your bucket list? And the goal is to match those up so that it is a mutually beneficial opportunity around the country. So I know that was one question that had come up on my question list. But I think that pretty much covers the core pieces of that. If there is, I don't know, do we have an availability to for those that listen to this remotely to send in questions as well? Perfect. So for those of you listening to the recorded version of it, feel free to tag either myself, Spencer, with any questions you have about travel PT. We'd be happy to answer those.